Okay, so in October we have awareness, breast month awareness. So I want to demonstrate to you how you check your breast on a monthly basis. Now, if you're having your periods, we normally check it 7 days after your period stop. That's when the breast is the best to check. If you have gone like myself on the other side where you've reached menopause, then do it on the first of every month. That will help you. So there's a few ways of doing it. You can do it in the shower. If you're doing it in the shower, make sure you lather your hands, and then it's very easy to do it. The first thing we do is we stand in front of the mirror and we put our hands on our hips and we look at ourselves. You look at the shape of the breast, you look at the color of the breast, you look at the nipple. Has it changed from last month? Has the color changed? Has it become flaky? Has it become red? Has the position of it changed? Has the nipple come out or has it inverted? Has it gone in? Is there any discharge from the breast? Now, if you are breastfeeding, definitely there'll be some milk coming out. But if you're not breastfeeding, is there any liquids coming out? So you stand with your hands on your hips and you look and make sure you take a good look at yourself. Then what you do is you put your hands up in the air and that will give a different dimension to your breast and you check again. Now, when you are doing the palpitations, what you do is your right hand checks the left breast and your left hand checks the right breast. You use your three middle fingers and you use just the back of those fingers. You hold your nipple and you gently press from the nipple in small circular movements going to under your armpit. And as you move, you make different pressures. So you start light and you go a deeper. Remember, you're doing this naked, right? I'm feeling my bra as I'm doing this. So you don't do that. You do it naked. Okay? And right under, all the way. Again, from the nipple all the way up. Once you have finished on the breast, put your hand on the head and check the armpit, because remember we have lymph glands under our armpit. So check under the armpit, still using your three fingers. Check if there's any lumps, any swelling. Now you do the same on the other side. You get your three fingers, starting from the nipple and going all the way out to the armpit. Again, changing the pressure as we do it to the armpit and again all the way to the armpit. Once you finish, put your hand on the head and again massage under by the armpit, checking for lumps or any swelling. Now, as I said earlier, if you wanted to do this in the bathroom, you make sure you have a nice ladder and it works much easier. So this is what we're doing. We're standing in front of the mirror with our hands like this. We're standing in front of the mirror with our arms up. And when you're doing the self-examination, you can do it in front of the mirror. You can also do it lying down on the bed, or you can do it in the shower. The right hand checks the left breast. The left hand checks the right breast. Ladies, this takes a few minutes. If you do it every month, you can really have early detection. Remember, early detection, early treatment, early recovery. If you find that there's any changes at all, please do not stay at home. Go and see your GP and they will refer you. You might have to get a mammogram, you may have to get an MRI, but again, early detection, early diagnosis, early treatment, early recovery. I hope this video has helped you and I hope it saves one or two of you out there. Thank you.